Okay, welcome everybody tonight. We are talking about EMSCULPT. This is exciting for us. We've really developed our body contouring division here at Aesthetics. We now have two cool sculpting devices, and we've now added the EMSCULPT device. So really exciting stuff for us today. I have Michelle Blondeel here, and we have Raj from BTL here, right behind me. We'll introduce him in a second. So first slide here. If you have not already done so, make sure you're registered to win. We have a free EMSCULPT session, so up for a prize tonight. So just make sure you click on the link in the video description, fill out the form. We'll announce the winner at the end of the presentation. So make sure you guys do that. It has a value of over $750, which is great. So sign up for it if you can. So we'll start off by talking about what is EMSCULPT. Okay, that's kind of the device we have here is a picture of it. We recently purchased it. The team's been fully trained on it. And it's a revolutionary, non-invasive body sculpting procedure that builds muscle while at the same time reducing fat at the same time. So it's a really exciting device. And what are people saying about it? So I'll just introduce Raj behind me here. He's from the company BTL Aesthetics. Raj?
Hey, sir. So BTL was actually founded in 1993 in the Czech Republic. So over 30 years now in the industry. We have three different divisions. So the company actually originated creating physiotherapy products, and from that we created two other divisions: cardiology as well as aesthetics. The EMSCULPT itself today was created in 2018, but we have over 30 different peer-reviewed studies, clinical reviews in all the reputable places, such as MRIs, CT scans, and histology reports.
Okay, so very, very credible company. We've worked with BTL as well. Anybody who has been on the EMSCULPT device here, same company, similar technology. We love it. It's great. It's groundbreaking, and it can show great results. So we continue with our investments with this company, provide great training. So we're pretty excited to have this. So, question people often ask us is, how does EMSCULPT work? And what it does, it uses a technology. It's called HIFIM technology. It's high intensity, focused electromagnetic technology. So basically what it does is this technology will strengthen muscle fibers, increase the number of muscle fibers, inducing muscle hypertrophy, which is increasing the size of muscles, at the same time reducing fat. So that's kind of a great combination to be able to do. And what it really does is it does what we can't do when we go to the gym. So most of us will know how to do a bicep curl, and we'll be activating a large percentage of our muscles. There's certain muscle activities that we do that we don't do well. So anybody who does any ab exercises, you're doing sit-ups, we're not really that successful in activating all the muscles. So we may get 20-30% of our muscles when we're doing crunches or we're doing sit-ups, as opposed to 100% when we're using this technology. So what this will do when you have a treatment, and in a 30-minute treatment, you'll deliver up to 20,000 contractions, okay? And this ensures proper technique to strengthen, build, and tone muscles. So, you can often find when you're doing this, you're not getting. It's hard to get proper form if you're doing other activities like that. So what it does is it generates its super maximal contractions, and it holds the muscle in contractions for longer periods of time. And if you've had this done, so I have one done today, for example. And it does a few things. So you have three different kind of cycles. You'll have a short pulse, which is just like if you just do a bicep curl, for example, just kind of like hold the contraction, let it go. That there is the short pulse. You'll have something called a long pulse. So you can imagine doing a curl, keeping it contracting for a period of time, and then relaxing. And then there's a third session where you're getting, it's like a tapping session that decreases the lactic acid buildup in the muscle, protects the muscles, also helps with the fat breakdown, the fat cell breakdown, apoptosis. So that's really what the technology does. And when you look at, if anybody remembers their physiology or from back in high school, looking at the action potential of a muscle, you'll have a nerve stimulus, action potential, and you'll have a contraction, which you can see here. That's a muscle contraction. With the EMSCULPT contraction, you're getting it to a force of a contraction. This is not physiologically possible, physically possible. Try to do it yourself. Okay, so this is really where the key is, what EMSCULPT can do. and what it does, what you can't achieve when you're in the gym. So maybe we'll just, Raj, you can just maybe kind of talk through the different technologies that are out there and what EMSCULPT has that the others don't.
Yeah, so I kind of want to start off with the TENS machines, because I think this is where most people are familiar with these type of products. This would be like your Dr. Hose machines, these like small battery operated machines, which you kind of connect that with little patches all across your body. Really, this product is like an at-home pain management product. So you're not generating any type of muscle growth here. You're really just trying to get some mild contractions for that relief if you have any pain. For TENS machines, a lot of people are familiar with the term EMS. So EMS is essentially another variation of TENS, except it's a little bit deeper. What we're doing is actually creating muscle stimulation. So there are other aesthetic products out there on the market that uses EMS technology, but the key difference here is that it is not stimulating any muscle growth. So BTL itself, on our physiotherapy side of things, we actually have a system called our super inductive system. And a lot of physiotherapists use that, the EMS system, to stimulate for muscle pain and joint pain. Our engineers created high FAM. So, with high FAM, what we're doing is we're delivering two different magnetic electrodes into the skin. So we get up to about 7 centimeters deep within the skin, and we're actually delivering muscle contractions. It's truly stronger than any type of muscle contraction that anybody could do themselves. And what we end up doing is, through apoptosis, we're able to reduce a certain level of fat while building more muscle.
Okay, great, thank you. So what you can see here on the next slide is what it actually does. If you're looking at a CAT scan and you look at the before and after, you see the abdominal fat layer, which is thicker than it is on the other slide there, and you see the muscle fibers. The thickness there is less. After 7 treatments, you can see there's a reduction in the abdominal fat layer, and there's an increase in the abdominal muscle layer. So it shows a hypertrophy on one aspect and a fat reduction on the other. So when people start, what is the best way to start? What's the best way to go at this? And when we start off, it's often the core, right, Raj? People ask, where do we start? Because we can do different parts of your body. You can do your core, your abdomen. You can do your buttocks, your glutes, triceps. You can do your arms, your legs. But maybe just tell us what the advantage of starting off with the core is.
I mean, obviously for the aesthetic purposes, everybody wants to have that lean six-pack, that's the desired look. But if we go a little deeper here, the core is so important because we use it in every single piece of physical activity. Correlated, a stronger core will improve your posture. It's going to make your lower back much better. Overall, if you're an active runner or if you're someone who goes to the gym, you probably know that your core is so important because you use your diaphragm for breathing. You use it for so many different muscle groups. So it's truly the key to unlocking all of your physical goals. Okay, good. And then the next group, which should come next, if somebody's putting a program together, would be the glutes. Absolutely, because when it comes down to any type of lower body muscle groups, your glutes are really where you're gonna pull a lot of energy. Now, I'm sure you've probably heard when you're moving a box or a big piece of furniture, people always say use your legs, or you got to use those muscles in your lower legs, and so this is where you hold a lot of that energy and that muscle. So you want to make sure that you're growing it. And the other aesthetic aspect right now is what's very much in is everybody wants that hourglass figure. Yeah. So unlike doing any type of fat injections in the buttocks or any type of surgeries, we're not trying to add a layer of fat. Instead, what we're trying to do is add more muscle.
Okay, very good. And then again, finally, we recommend arms and calves. Like this is almost a secondary, but some people like to start with this if that's where they want to focus on. So we have some clients that come in and they want to work on their triceps or biceps or their legs. Again, this is another option, but often the core is so important to get that established first, right, and strengthened. So so these are all the different options people can or areas people can work on.
All right, so the difference between cool sculpting and EMSCULPT. So cool sculpting is really for fat reduction. So trying to get rid of those stubborn pockets of fat that you can't get rid of with diet and exercise. EMSCULPT is more for sculpting, toning, building more muscle, rather than kind of getting rid of fat.
Yeah. So we often say it doesn't like it's when you talk about body contouring. Yes, that's where you come at it. But there's always value in increasing your core muscle strength, which is why EMSCULPT, even though you may not be your ideal body weight, that doesn't mean you still can't find benefits from EMSCULPT. So if you're somebody will have a slide coming up, if you've had a baby, you have diastasis recti, that's separation of the muscle, you may say to yourself, hey, I'm not at my ideal body weight, I've just had a baby, I finished breastfeeding. You can still go ahead and get this treatment done to help improve your core. People who have back pain, so if you're suffering from back pain, although we don't apply the applicators aren't applied to your back, they're applied to your core, your abs, and that what helps strengthens and improves people with back pain as well. So there's lots of uses. A lot of the pictures you'll see tonight will be, people going for that kind of shredded look, people who are already lean. That doesn't always. You can still have your muscles like under your fat layers, and they can still be serving some benefit, especially for core muscle strength. So, pop quiz, Michelle.
So what does HIFEM stand for?
Okay, so A, B, C, or D. So we're doing a little pop quiz. Okay, so whoever wins, the first person to answer correctly wins $25. Looks like we'll only be looking on Instagram. Is that what I'm hearing?
Nope, we got Facebook coming in now too. We're just waiting for a few people to answer.
Okay, we can announce the winners when they're ready.
Mm-hmm. Yeah.
B. Vicky won.
Okay, so the answer is B, yes. High intensity focus electromagnetic therapy. Okay.
So I haven't seen anyone come through Instagram yet.
Okay. Okay, so we'll come through with, we can announce a winner for Instagram later. So we'll move on to the next. So this is coming back to the question, who are the right candidates for this? These are, again, people ask this question. So there's no magic treatment or pill or any technology that's going to, you deliver everything you have to deliver on, right? So cardiovascular fitness, core strengthening, increasing muscle tone, increasing muscle mass. It's all part of a healthy lifestyle. And EMSCULPT is a great jump start to it. People are already who want to start a fitness regime. It's a great way to start it. People are already in the middle of a regime or have been working out for quite a while. They love doing this. You'll start activating muscles you haven't activated before. You find people who are, they're avid, people who go to yoga or athletes go to yoga, other sports. They do EMSCULPT and they can find themselves doing poses and doing maneuvers that they never could do before. And it's basically from activating these muscles that they weren't activating during their normal regime. So this is something you spoke about as yourself, like when you when you're doing certain exercises when it's time to get back for a maintenance program.
Yeah. That's exactly it. So I like doing it, and then I like every other day doing a set of crunches. And the minute I feel my obliques are just contracted, I instantly know that's time to go back for more.
Right. Good. So again, people with a busy schedule, again, like the amount of contractions you're doing a 30-minute session, you're doing the equivalent of 20,000 contractions. You just can't get that return in the gym in a 30-minute regime. And especially when you do this program, after 2 weeks, you're doing equivalent of months in the gym. And again, not at that level. You're not getting that 100% base efficiencies. So people recovering from injuries, great for that's really where BTL, where you guys really started off with was physiotherapy. Am I correct? In this technology. So yeah. So and then this is something we see again is something called diastasis recti. I do OB. A lot of patients that come in after they've had their babies, and you can see the separation of the rectus muscle. Quite common in the postpartum time period. It takes a long time for it to come back together. Sometimes it doesn't. A lot of clients and patients are looking for a solution for this or something to help with that. And again, EMSCULPting is great for that. So you would make sure that you're finished breastfeeding, and once you're done breastfeeding, certainly come in for treatments because it has been shown to be effective. There has been a clinical trial to show it. So That's wonderful as well. So we're going to do another pop quiz, whoever is out there listening. So, Michelle?
So which of the following are advantages of EMSCULPT?
So, increased metabolism. Does it deliver 20,000 contractions to build and tone your muscles? It can be used in the recovery from injuries, or D, all of the above.
So Nurse Jess was our last winner on the last question from Instagram.
Okay, well done, Jess. Okay, and anybody does multiple choice, all of the above is always a good option to go with. Okay. What's that?
They can come in for the gift card.
Yeah. So whoever wanted the gift cards, Nurse Jess, just come in and pick up your gift card at Aesthetics tomorrow or anytime this week. No problems at all. Okay. Do we have any? I'll announce the winners.
Kim B
Okay.
is the winner from Facebook.
Okay. Well done, Kim. You can come collect your $25 gift card.
And then we also have M. Herkmans
Okay.
from Instagram.
Okay. Well done. Okay. So let's kind of we can now look to see. Let's look at some results here. Okay. So if you haven't registered to win, make sure you do that. And because we'll be doing a draw coming up pretty shortly. Okay. So let's see some results. So people want to see, like, a lot of what we do in the aesthetics industry is before and afters. It's important for people to see. You're not just taking our word for it. These are all pictures from BTL, from the EMSCULPT programs. And you want to talk through some of these, Michelle?
So clearly more defined abs, definitely a lifted buttocks.
Yeah. So maybe Rush for the buttocks, like maybe describe what people see here. Just like without.
Sure, absolutely. So if we look at the before picture to the left, you can see this female patient clearly is suffering from more of a flattened buttocks, right? What we often call it that pancake butt. So, to really improve the growth here, doing the 4 standard treatments on the buttocks, you can see she's not only added more definition, and she's brought that curve back in the after photo there.
And then the abs, you can clearly see the improvement in the obliques, or that kind of six-pack figure. Again, so what you're noticing is two things. Again, is a decrease in the fat and increase in the muscle tone, okay, and muscle fibers. So it's quite evident in the before and afters here. Again, as we said, you can you can do these on your calves as well. So to get your calf definition. So again, you're seeing improvements in muscle definition, increased muscle tone, increased muscle fiber, and decrease in your fat. So it's definitely improved. So this is really, we talk body contouring. Same in the arms, okay? So especially for people who are having difficulty with reducing some of the fat and adipose tissue and increasing your tone, you can see definitely in these lower pictures the improvement in definition and biceps that they may not have had before. So this is a lot of this should be in combination with a healthy lifestyle, with working at the gym. When you do it in combination, you see great results. Okay, you'll still see results without going to the gym, but I think a lot of people who want to invest in EMSCULPT are also, adhere to a healthy lifestyle. Right, Raj, you said it yourself. Is that a lot of the clients are already engaged?
That's exactly it. If you use it as a supplement, that's the way I like to look at it.
Yeah.
The results are going to be phenomenal. It's going to help you kind of get over that hump that maybe you have in the gym or your daily life to not only get that better physique, but feel better.
Okay, very good. Again, these are, look at the buttock lift as well, non-surgical, and just improving and giving that new contour there. So it's a common request that we get from certain clients, and it's a common cycle that we engage in here. So people ask, like, what is the optimal treatment regime? So Michelle, you've been through all the training.
So it's 4 treatments, 2 to 3 days apart, within 2 weeks.
So so that's the optimal. Some people may spread it out a bit longer, depending on work schedules. But you want to feel that muscle soreness. You want to feel it, So there might be people ask about the results, like how long does it take? So although the initial treatment is done over a couple of weeks, it takes a few months for you to actually see the results. You can notice the strength and increase your muscle strength. For yourself, Raj, how long would you say it would take before you start feeling the muscle strength that you hadn't felt before in your core?
So to feel the actual muscle strength itself can be anywhere between 2 to 3 weeks, truly. And that's just because the way your body is activating. You'll be able to feel those muscles and by just doing, daily activities, maybe you're reaching at the high shelf in your kitchen to grab that plate or that dish, maybe in the gym, even when you're running, like you're definitely going to feel something within your core. Now, over time, about month 3 is when you're really going to be seeing more physical appearance. And the nice thing is, EMSCULPT, doing your full 4 sessions, those results are going to last you a whole year. Because remember, you're doing 20,000 perfectly contracted crunches each treatment. So those results are going to, give you a full year of great looking results.
Great. So after you do that, you should engage in a maintenance package, just like you think of joining a gym. So a lot of the clients will come in once a month for a touch-up or start working on different parts of their body. So they may come in initially and do their core, and then they may kind of move on to the glutes or to their arms or their calves. Is that what you normally see as well, Raj? That's a kind of a typical kind of progression, but certainly most people that get it, like I've had my I'm kind of looking forward to my next one. I have one done today. So you kind of get very excited about it. And is there a picture of me next, or did we miss it?
We passed it.
Okay, you guys did the draw for already? Yep. So you guys just stand there.
Yes.
Just put the name up there. Okay, so it's already.
It's our magical box.
Okay. So it came up with another okay. So. Okay.
Who's the lucky winner?
And.
The lucky winner is Krista Kolomiko.
Okay, very good, Krista. So how does Krista win? Krista wins a free session valued at $750, which is great, Krista. So it's wonderful. So you can come in and collect that, and maybe have a consult with Michelle, and you can talk about some body contouring and the options of the different cycles, what you might want to use it for. So that's great. So the last kind of session or the last part of the presentation is there any questions from the audience that people may have that either myself, Michelle, or Raj could answer for you?
I had one Instagram question come in. Can EMSCULPT, when you treat it on your abdomen, help with your back posture?
Yes, that's what it really does. So it helps with your muscle core, helps with back pain. Any comments there? Any extra, Raj? But
No, I mean, you hit it right there. It's indirectly going to benefit your back and your posture, just because we are strengthening your core.
yeah, so that's really a lot of most of the. I mean, would you say the percentage of people who start off doing core, like 70-80% are focusing on the core to begin with?
Yes.
Yeah, so that's an important part.
I had a question from Facebook. Is there an age restriction to the EMSCULPT treatment?
So I mean, we don't here at Aesthetics, we don't typically treat under 18. And again, it's once we take a full, complete history. So is there anything is there an upper age in the literature that you have? It's more the comorbidities and some of the contraindications for doing it. So having metal, any other unstable diseases. But anything, Raj, from your perspective?
You did it right in that. And listen, I've heard multiple stories from other clinics across North America. People, within their 50s, 60s, just looking to kind of improve their daily life, and they're using the device and seeing phenomenal results. Yeah.
So again, as we age, it's hard to maintain your core strength. We know one of the most common complaints in family practice and my practice, 25% of my patients come in at some stage with back pain, especially those over 50. So this is really that's what prompted me to do it. I recently had the back pain, so I'm trying to strengthen my core, and it's something that most of us don't like doing in the gym. We don't like doing, abs. I mean, I don't like doing abs. So, you still have to do it, but this kind of does give you a bit of a jump and kickstart.
I have a couple more questions that came in through Facebook. So can you do treatments between the initial 4 and the 3 months, or do you recommend waiting in between until you see those results?
Good question. So after your 4, I mean, you can absolutely come in the following month for more of a maintenance touch-up. It's recommended that you space out your maintenance treatments about 1 month apart each following time.
Yeah. But you can start on other muscle groups as well, right? In between. So
yeah, we start another muscle group.
Yeah. So certainly, you do your 4 treatments over 2 weeks. Then You get into a maintenance program, and again, 4 weeks apart is recommended.
Okay, a couple more questions. So, does it help menopausal bellies, or like the bellies you get as you age?
So again, this is probably coming back to core, right? So as we age, especially with hormones, as you age, male menopause, female menopause, we're losing some of our muscle mass. You're losing some of your core strength. So certainly this is ideal for that. So it's not, we don't want people to think of EMSCULPT as just body contouring and body sculpting. It literally can like help people strengthen their core, build their core, kickstart a regime. So those who are just having trouble, like getting motivated to go back to the gym, you make this investment yourself. You continue that with the gym. You continue with the maintenance program. So it certainly does have value, and yes, it would, because it decreases your fat, your body fat percentage, especially in the abdomen. If you're doing the abdomen, you can see from the CAT scan we showed before, it increases your muscle mass. So yep.
Alrighty, so our next question is, as you age, you're developing more fat in your back. Will it help with this?
So we don't apply, so we all accumulate fat in different areas. So our body fat to, like our BMIs, like when you look at the percentage of you look at the body mass index, as we age, we're losing muscle mass and we're gaining fat, right? So again, this counteracts that, does the opposite of that. It increases our muscle mass and decreases our fat. So yeah, so it's again, whatever you do up front helps you behind. So we have a lot of patients that come in and they have, they have back pain, they lose some of their abdominal girth, and it helps them. You have some females who have large breasts, they end up getting a breast reduction, often because they have upper back pain. So you often think of where the pain transmits, and it kind of goes to the opposite side. So again, people who have knee pain often may develop hip pain, quad pain, pain in their hamstring. So it does help. So if you strengthen the anterior aspect, it'll help the posterior.
And one more question. So, do gym membership discounts apply for EMSCULPT?
Yes, yep. So if you are a member, so Sapphire members get 20% off, Amethyst are 15%, and Jade are 10% off. And that's the same for the maintenance programs as well. So certainly if you're making this investment, it would be wise to join a membership program because it gives you the automatic discounts for the whole year. So we certainly encourage it. And most people who make the initial investment, we hope that you would want to continue with the maintenance program because that's all part of it, right? So although you will see the results that will last throughout the year, you may move to other muscle parts or just do the maintenance.
Sorry, one more question on Instagram. Does this pair well after cool sculpting?
It's ideal. This is often where people go. When you're looking at body contouring, you want to kind of see if you can lose those layers of fat, and then sculpt, right? That's the experience you've had.
Basically, yeah.
Yeah. So again, so if somebody's if somebody's been working with cool sculpting, working on their abs or their abdominal regions, and then they then get the definition and increase, and they get a further reduction in their in the fat layers as well. So
one more question came in. Do frontline workers still get a discount?
yeah, so our discounts are going to the end of the month, so up into Labor Day as well. So yes, come and get it, and you'll have an automatic discount. Okay.
That's all the questions that I have.
Okay, well, thank you so much, Raj. Thank you for being part of the presentation tonight. Thank you, Michelle. And again, if you're interested, fill out the forms. We'll contact you. We've going back to what we have in aesthetics from a body contouring perspective. We have more technology than anybody probably has in Ontario. We have jewel sculpting, which very few clinics across Ontario have basically two cool sculpting machines. And then we have an EMSCULPT on top of that. We have the Emsella. So there's lots of technology here that we'd love to get you're using and see what we have here. So book a consult with Michelle or Lisa, and we'll get you in. So thanks for